biggest concern for the public is, why do we need this vaccine?
Well, I think as we discussed earlier off air, we're not here to make people or force people to get the vaccine. It's not mandatory, but we do want to give them more information, more reassurance, so that they can make an informed decision. And as Dr. Williams said earlier, there is public perception that this is a new vaccine. Everybody's worried about whether it's safe. But as he reiterated, the technology isn't new. It's a new vaccine, but they've been doing this work for a long time, and they've had other experiences with other COVID strains. So now they were just able to all work together, the scientific community, to develop this vaccine for this specific strain, COVID-19. So we all, I think, can agree that we want our lives back. And this is definitely the first step to getting that, because we want the protection for our vulnerable population.
Now, you said there's 280 vaccines in the works. It almost makes me think that every country in the world is doing one. I want to joke and ask you as came on, but I'm not going to. Should people think about taking all three, or just one?
So far, with the information that we have available, the recommendations are that person take, as we all know, all those 3 vaccines that have been approved so far, they need 2 doses. And both doses is recommended to be from the same brand. So you take Pfizer on the first dose, you should take Pfizer on the second dosage. The same with Moderna or the AstraZeneca. And to answer your first comment, I think it's a public knowledge that actually there's one vaccine that has been trialed here in the Cayman Islands.
Oh, okay. No. Yes, you're right. I did remember reading that. Yes. How's it administered by a?
It's administered by a public health nurse, and it's given similarly as you would have gotten your flu vaccine in the upper arm. It's an intramuscular injection.
Okay. And we said there are 2 doses. What is the duration between doses?
For the Pfizer one, which is the one that we'll probably need to focus on that one because it's the one that we have here in Cayman, is 21 days between doses. So after the first dose, individual will normally get around 7 days after we get a protection up to 77% protection. 70% after the first doses. And then 21 days after that first dose, you get the second dosage. And 7 days after, you should get maximum protection, which is around 95-96%.
Can you still get COVID if you're vaccinated?
You can, because not everyone amounts an immune response. In other words, not everyone is going to create antibodies. However, no vaccination is 100% effective, but you do, as Dr. Williams said, after the second dose you have approximately 95%. So your chances are slim, but there is no 100% protection.
Can you spread COVID during this 21-day period? I mean, you don't get the virus. You don't inject the live or the dead virus in this. So there's a different process. So you theoretically, you can't spread. You shouldn't get COVID. You get symptoms of it. What are some of the? I'm trying to form a question, and I'm all over the place. Sorry. So, are you contagious during this time if you get symptoms of it?
If you get symptoms of COVID, meaning that if you get infected, even though you may have been vaccinated, like Dr. Simmons just stated, being vaccinated doesn't give you 100% protection. So you could get infected even though you are vaccinated, even though the risk is a lot less. But if you do get infected, there is a possibility that you can spread the disease, yes.
Some of the symptoms after you get the vaccine is coldly, you feel yucky.
Mm-hmm. Like with most vaccines. Right. So you could get symptoms specific to the actual site, so you could get swelling to the injection site. You could get redness and, of course, pain, just like when we all have gotten our vaccines throughout the years. Other side effects from getting it as well. General, where you could just feel tired, headache, and as well chills. Sorry.
So, but that doesn't mean that you are in fact having COVID. It just means
those are normal side effects that you would get once you get any vaccination to look out, and they usually disappear within 24 to 48 hours.
So there's no quarantine time after you take the vaccine?
Not if you're going to remain on island, no.
Okay, yeah, all right. If you're leaving, you have to be quarantined?
You mean if there's no quarantine once you've gotten the vaccine? Not if you're staying on island. You don't need to quarantine once you've gotten the vaccine. However, I presume if you go to another country and they would have COVID-19 protocols in place, you would have to adhere to that even though you've gotten your vaccination on board.
Cool. I understand. We discussed the risk, which... So what are the risks if you don't take it?
Getting COVID-19, definitely.
And it's a crapshoot, really. I mean, you don't know if you're going to be the one who gets terribly ill.
Yeah, we know that the disease, the COVID-19, affect more the elderly and those who are immunosuppressed. So a lot of us might think, well, I'm not in that age group yet. I don't have any chronic disease, so I'm not at the high risk. But we need to think not only for us. We need to think for our families, for our friends, for the elderly. We need to be able to get vaccinated, not only for us, but to protect them as well. And also the children, that so far this vaccine is only approved for 16 and over. So by vaccinating the adult population, and we get a high percentage of the population vaccinated, we are protecting those ones that for one reason or another cannot be vaccinated at this time.
And we have to also keep in mind persons with certain medical conditions, if they were to contract COVID, they would be at risk for severe side effects or a severe illness with COVID were they to contract it. So this is another reason to encourage persons to get vaccinated as well.
What if you have COVID, you've had it, say,
in the past. That once you've had it in the past and you've recovered, so that doesn't prevent you from then being eligible to get the vaccination. Because we actually still do encourage you to get the vaccination once you have recovered. If you have an active COVID infection, you would obviously be in quarantine, but once you're out and recovered, we do encourage you to get your vaccine.
What about this new strain that we're hearing that's more contagious? Is that accurate? Is it more contagious and less virulent? The viral load is lighter, or is it just the same, just more contagious?
Well, it's more virulent, and that's why it's more contagious. So it has been proved that it seems to be more contagious, especially in the UK and other places where they have actually seen this new variant of the virus. What has not been proved so far is that it's more severe, that the infection is more severe. So there don't seem to be any major complication compared to the rest, similar, but it seems to be more contagious, and that's because it's more virulent, actually.
Is it so? Does that mean it's airborne? When you say contagious, what does that mean?
No, the way of transmission are the same, which are droplets, but the infectivity is higher. So the different bacteria and viruses have different level of infectivity. Some of them are very, very, very infectious, like measles, but some are not that infectious. So even if you get in contact, the infectivity is less. This new variant of the coronavirus seems to be more infectious than the previous one that we had in the outbreak in the past, which is concerning in the fact that, of course, more person will get sick and more person will spread. So it came with a good timing in the sense that now we have 3 vaccines, effective vaccines that are available. so that we counteract this new variant of the virus.
And the vaccines work with it?
The investigations seen so far have proved that the vaccine is effective against this new variant of the virus.
Cool. So when are you guys going to be getting the vaccine?
When?
Yeah.
I will be getting mine tomorrow. Dr. Simmons as well.
Likewise, yes.
Dr. Simmons and Dr. Williams both are smiling. Is that a nervous smile or like hallelujah, I'll be able to get my life back smile?
It's a little bit of both. I've said to friends and family members, that this is a leap of faith, and I don't think we should take that lightly. We are in a blessed situation in Cayman. We've been protected. Our government and public health colleagues have done amazingly to protect us, and now the vaccine is here. And as Dr. Williams said, the vaccines came at a perfect time. It was almost serendipitous. So now we're fortunate enough that we could try to get as many people vaccinated, get us protection, so that when our borders do open, our residents are hopefully as protected as possible.
Yeah, we are living in a bubble.
We are, but a blessed bubble. There are few countries who can say the same, that have this opportunity that we have.
Yeah, I have so much gratitude to our government and the residents. We all work together to achieve this. I mean, this wasn't done in a vacuum.
No, it takes a village, literally,
yeah,
to do all of this.
I lost an uncle on Sunday in Florida who contracted COVID, and the other complications, he died. So, we have this vaccine, and I hope people will go out and take you up on your offer. Now we have 9,750. Okay, so that's the first set. I guess you're going to be getting more.
That's the first batch, and of course, as you know, that there are 2 doses, so we have to divide that by 2. So we'll be able to start giving close to 5,000 individuals, but we will be getting more batches pretty soon, for what I have been told. I don't want to give a date because we don't have a final date yet, but we will be getting new batches pretty soon.
Will you need an annual booster?
The studies so far are ongoing on that, and there's no recommendation at this point to get an annual booster after the second doses. Of course, the studies are ongoing, and we need to see and wait until they finish to see if there's a need to an annual booster every 2 years, every 3. It all depends on what the studies going. The initial group has not gone a year yet since the vaccine started on the phase 3 of the investigation. So it is hard to say how long the protection is going to be, and if any booster will be needed and how often.
And so you were saying it would be administered by a public health nurse. So what time is the clinic open for this tomorrow?
Tomorrow, actually, there is a press conference, and we'll be announcing the rollout, the plan and the schedule. But it will be Monday to Friday. We'll start tomorrow, but mostly tomorrow will be
the healthcare
workers, certain group. For the general population, more likely will start from next week, and it will be 6 days a week. They will start in Georgetown Hospital and also in the district health center, and the public health nurse will go to a specific center institution like the retirement homes and other institutions, the other 2 major hospitals, to actually give the vaccine there to their staff and also to any client that they may have there at the time.
As well, the private sector as well, they'll all be offered. So there's a calendar that's coming out. They'll be able to give people an idea of how we're going to roll out everything and how they can best access it.
Is it free, or they got to pay $100,000 each?
No, it's free.
It's free. If you'll be getting it with the Health Services Authority or Public Health, it's free. But I think eventually when we do open it up, I do believe there was some discussion about there possibly being a administration fee for private sector. That's still a small amount, but for now, with this first batch, they're all free.
Okay. What would you say to someone who's sitting on the fence right now? I mean, when you heard of vaccine, take off your medical hats for a minute.
Well, normally I take vaccines regular. I'm actually vaccinated for most of the vaccines that are available. I take my flu vaccine every year, and like I said, I'm not doing for myself that much because luckily I'm pretty healthy, but it's just to protect others around me. So those persons who are on the fence, they may think they don't need it, or they may have doubt. Just think that the others close to them that will benefit if they get the vaccine. The vaccine is safe. They have been approved. They have been used now in millions of persons, and we haven't heard of any major event or side effect so far. So it's a safe vaccine. It's effective. Have been studied. Have been going through the process. So I will tell them to go ahead and immunize themselves, not only to protect themselves, but to protect others closer to them that will be more vulnerable to the disease.
I'll have to piggyback on that as well, but I think I would tell that person on the fence that it's absolutely okay to be on the fence. It's okay to have that initial fear or questions, but we are here to answer your questions as best as we can. And I agree with Dr. Williams. What pushed me over was my loved ones as well, is to protect them and to protect our future.
Yeah. Because we can't live
in this bubble forever.
Yeah, I completely agree now. Is this the vaccine, the Pfizer vaccine, that requires sub-zero temp?
Yes, this one has to be stored at minus 70 degrees Celsius, which would be comparable to being as cold or colder than Antarctica.
Correct.
So we had to get special fridges for this.
So, how can you be sure that from going from the Pfizer lab to the plane to, from the plane to hair, and then in your labs, that it hasn't, that temperature hasn't either got really, really hot or somewhere in between?
There is a cold chain process that is applied to all vaccines. And all vaccines are transported with thermometers for us to check in each step what the temperature. If the temperature drop or change or go higher for any reason, then that we usually will consult with international organization to set if the vaccines are still effective or not. This is not the case. The vaccine arrived here. They were transported in dry ice, which will maintain the same minus 70 Celsius degree temperature. So, and they arrive here with plenty of dry ice, so they arrive in good condition. They were transported very quickly from the airport to the HSA, and we have acquired enough storage capacity for this vaccine and more to come. They were tested, they were revised, everything was checked, unpacked, put on the freezer. The freezers already were at the appropriate temperature, so everything is in place now. But it's a cold chain that is checked along the way, and even now the freezer itself have a thermometer inside just to make sure that they keep the temperature, and they have an alarm that will trigger if the temperature drop under certain levels.
So this is I asked you this question earlier. You don't inject it at sub 70 degrees, right?
No, there's a certain amount of time that we have to remove it from that temperature. And it's then put in a regular fridge where it can stay up to 5 days.
Yes, the vaccine can stay. Once you remove them from the frozen stage, they can stay in a regular freeze.
And once it's from that freezer, it can't be mixed for preparation after a minimum of at least 2 hours from coming from that minus 70 degrees.
Okay. Is there a reason why it has to be so cold?
I think during the investigation process, they realized in order to preserve the chemicals and all that we use in this vaccine, and to maintain it to be effective, it need to be at that temperature. It's not common for vaccine to have to be kept at that temperature, but this is a new vaccine. We expect that some of the other vaccine coming in the future will need to be kept at that temperature of minus 70.
Okay. We have a couple of minutes, a couple of seconds, not minutes. Just encourage our audience to encourage?
Well, first, we want to thank you to give us the opportunity to be here and to talk a little bit about the vaccine and clarify some doubts. We do encourage the public to go out and get their vaccine. There is a priority list, and the elderly and healthcare provider will be first on that list. Also, our frontline staff at the point of entry. But do it for yourself, do it for your family, do it for your loved one, and do it for your country. We need to open up eventually.
And from my end, it's just to remember vaccines aren't new. I think for most of us in our lifetime, we've grown up with having to get our polio, our MMR. It's just we're used to it. I think our hesitation is because this one is new. But there will become a generation who, for them, this COVID-19 vaccine might just be part of that profile as well. So take your leap of faith.
Thank you so much, Dr. Simmons and Dr. Williams-Rodriguez, for being on for the health of it. And I'm sure that I'll be joining you in that line somewhere along the line. Not quite elderly yet, although I'm on that track. But I'll see you soon. Thank you for being on for the health of it.
Thank you for having us.
Thank you very much.
We are moving you to the life you want.